during our advocacy listening session that Christina and I had. I think it was earlier this year. It might have been the end of last year. Who knows at this time? Um, one of the things we talked about was the overlap of a lot of other meetings with this call, especially for our NAMI friends and the amount and volume of national calls. So a lot of them can't make it sometimes. So we're recording them again and we're putting them up on the NAMI Keystone YouTube page. And I put that link at the bottom of this month's agenda. There's also the 2 advocacy capacity building sessions that we've done previously are also there. First one was on mental health advanced directives, and the last one was on Brain Fart Policymaking 101. It was the workshop that I gave at our state conference this May, and due to overlap with a lot of other kick butt workshops, I know some people couldn't make it, so we decided to do it as a webinar. So I'm going to go ahead and jump right into the agenda. There has been some movement on the budget, but we still don't have one. So House Bill 1330 is currently in the Senate right now. That's the bill that will fund the executive branch of government. So the governor's office, all the departments, DDAP, aging, housing, etc. It'll allow the state government to continue to operate. So that's made it a little bit further than the actual appropriations budget for the rest of the budget. That one is Senate Bill 160, and it's currently sitting in House Appropriations. So it made it out of the Senate. It went to the House on August 12th, and it's currently in the Appropriations Committee. The first committee vote was mostly nays, so they're rewriting it to their standards, whatever that might be, and then I guess they'll vote on it again. Not I guess, they will vote on it again. But saying I guess is an exasperated language because nothing's happening with it. And I know there's a lot of things that are on hold right now until that budget gets passed and is funded. So please, nobody hold your breath. I don't want you to pass out and hurt yourself, but hopefully we'll have good news in the coming days, weeks, however that might work out. Does anybody have any questions on the budget, or maybe have heard something that I'm not aware of? Like I said, I've been out of the loop for the last 3 weeks, work-wise, although I've been working. So, anybody? No? Okay. I will say, I've talked before the fact that I'm on the Mental Health Planning Council, and we meet once a month with Deputy Secretary Jennifer Smith or a representative from her office, and we had that meeting on August 8th, I think it was. Definitely not the 9th. So yeah, it was August 8th, that Friday. And they were kind of reassuring in their thoughts on the budget. They think we're going to be okay for the most part, mental health funding wise. There's some things that are up for negotiation and being negotiated now. I was in the car when I was on that call, so I wasn't able to take a lot of notes. So I don't know those budget concerns right now off the top of my head. But we were reassured that things are looking okay for mental health funding right now. So I do with that information what you will, but they weren't too concerned. Although, again, what's happening at the federal level is definitely impacting what's going on at the state level right now, as the Senate is interested in making cuts ahead of what the federal government has said they're going to cut. So I guess we'll see how that goes. But that's all I've got on that one. Next up is the OMSOS bulletin about the new involuntary commitment form. So that bulletin came out earlier this summer, and they put a 60-day hold on it because of stakeholder feedback. Well, because of overwhelming stakeholder feedback, I hope some of you all participated in that effort. They've put an indefinite hold on it while they relook at the form itself and take into consideration all of the stakeholder feedback that they received. There were a lot of pertinent sections that needed to be re-looked at and revisited. Some that were previously included in that document that were no longer in the document. However, county level officials feel that it's a necessary part of the commitment form. So while they review that and go back to the drawing board, the whole entire thing has been put on pause. So if you're a delegate or have delegate ties, I'm sure they're all aware of that. And I also know we haven't met in 2 months, so thank you for your patience with that. But that's what's going on with that right now. Katie in the chat says she has heard rumors that there may be some movement potential on the mass transit funding if there is a compromise on school vouchers. Yes, thank you. That's one of the things that Chris and I had talked about yesterday when I was in the office about the transit funding, and that's something that's kind of holding the budget up right now. So Katie, feel free to come off mute and talk about that, but absolutely no pressure if you don't want to. But transit funding is definitely one of those things that's holding up the budget. And school vouchers, I feel like that's standard every year. We go through the same thing year after year regarding school vouchers. So
yeah, it's just a rumor that I've been hearing in a bunch of different meetings. So I can't like confirm that it's actually a thing, but I've heard that's like the bargaining chip that's happening between the Republicans and the Democrats right now. So we'll see what that turns out to be. I don't even know the specifics of it because it's different in every meeting that I go to. I'm sure you get that, Nikki. Like,
yeah, I do. Uh-huh. Yep, absolutely. And who would have ever thought that mass transit would be a bargaining chip? But here we are.
Wait, so I have a question.
Guys.
So basically, how would that deal, like, what would the deal be? Like, if you give school vouchers, they'll agree to mass transit?
I think if they loosen the regulations around the school vouchers,
Okay.
then
Okay,
that's
gotcha.
because there's a bunch of bills that get introduced every session and they always get shot down. So I think the like discussion is like it's like a give and take. It's their bargaining chip, from what I've heard, is like, let us have this, we'll let you have that sort of thing.
Gotcha.
And Sarah, Nikki, do you want to answer that or do you want me to answer that? What Sarah put in the chat about the skill games? Because I've heard about that too.
You can answer that if you want. I know a little bit about that.
Well, you probably know the same I know. So everything I've heard is that the Senate Republicans are not interested in any of the proposals that have been put forward around taxing skill games or or recreational marijuana. They're not looking at any of those things right now. So they just keep putting them off the table. I don't know if you've heard anything else, Nikki, but that's sort of what I've heard.
No, Chris and I had that same exact discussion yesterday. Yeah.
I know that the aging
on the recreational marijuana thing, but I'm not that person, so I'll keep them to myself. Somebody came off mute.
Yeah, that was me.
Okay.
Lynn, the skill games issue is near and dear to the heart of the area agencies on aging because it's been proven that even just the very existence of skill games have been taking money away from the Pennsylvania lottery. And the Pennsylvania lottery is what is used as the primary funding for all of the area agencies on aging. And so I know that our lobbyist has been lobbying for those tax dollars to go to the area agencies on aging. But that's all I know.
Thanks, Lynn. Appreciate that. Anyone else have anything? All right, moving on. 988 back in the spotlight. DHS is restarting their meetings this week. Actually, they took a few months off from those calls to kind of regroup and reorganize because we would have an advisory committee on one Friday, and then 2 Fridays later we'd have the advocacy committee, and it was the same people. There were a few meetings that I was the only person in attendance, so I got my own personal update, so that's always fun and exciting. But in an effort to kind of keep everybody on the same page and not have the same meeting twice a month for the same people, they're regrouping, and now the advocacy and advisory committee are combined, and I don't know what the name of that new group is going to be. So our first meeting is this Thursday. I don't even remember what time because Thursday's busy, busy, busy. But as soon as I get any kind of updates, of course, I will absolutely pass them along. Especially if it's something major that needs to move. Speaking of 988 movement, there was some positive movement, kind of, as far as the 988 education campaign is concerned. It did make it out of the House, however, it went to the Senate Health and Human Services Committee. And we know what happens with mental health legislation when it goes to the Senate Health and Human Services Committee. So fingers crossed that it does clear out of there and goes to a full Senate vote. Because getting 988 codified period anywhere in Pennsylvania law will be huge for actually moving it forward. I know I've heard that that's been some of the hesitation with some of the other 988 legislation that's been brought to the table, and getting that passed, that, it's a federal mandate, but it hasn't been officially codified into Pennsylvania law. So hopefully I've got some positive updates in the coming months about that. Oh, okay. Bethany has popped in the chat. It is the 988 Advisory and Advocacy Coalition, 2 p.m. on Thursday. Thank you very much. Like I said, Thursday is a crazy day for me. I'm doing the Own Sauce new member orientation first thing in the morning, and then I have a meeting with the lobbyist in the afternoon, and then that meeting, and then I have another meeting after that. So that'll be Thursday going to be a fun day. I appreciate that, Bethany. Thank you. Like I said, I'm trying to get my life back together, work-wise. So session days left. We're kind of like ad hoc session days right now because technically they're supposed to be on break, but that's not happening fully because there is no budget. So I haven't checked recently to see if they have set days or if we're just kind of winging it right now. As the days go on, I know if any of you get Katie's awesome legislative roundup, it's been kind of slow lately. Not a bad thing because really they do need to focus on the budget, so we can start either breathe a sigh of relief or like get some awesome advocacy going, depending on what they decide on. So we'll go from there. A few bills of note though. House Bill 1706, the mental health awareness for students and coaches, would mandate mental health resources be given out and made publicly available to student athletes at a minimum of twice a year. At least twice a year, make that announcement that those resources are available. Like I said, have them posted somewhere publicly, either on the school district website, athletic department website, and then to make that announcement twice a year or remind them that those resources are available and this is where they're at. So the other thing I have on here, Senate Bill 475 about strengthening pH treatment courts, and the plan to do that. That was actually signed into law on July 21st, so that's a good thing. Treatment courts work, so happy to see that somebody's taking that seriously. I guess we'll have to see what regulations are promulgated and what it actually looks like on paper once we get there, but I'm just happy that something happened positively in the mental health space this legislative session. So anybody have any questions, comments, or concerns on that one before we go? So for federal updates, again, our national office, Stephanie Pasternak, she does state relations for NAMI National, sends out an email every Friday. I've saved that email as a message and I attached it to this email with the agenda and all the other documents. So feel free to peruse that. There's also a link that you're able to sign up for her newsletter as long as you're part of the NAMI Alliance. If you aren't, I'll continue to provide those as I can during this call. But all kinds of great information in there. What's happening with the Make America Healthy Again thing. When I say thing, what they're trying to do with Make America Healthy Again. And just like what's happening with the federal budget. Any concerning legislation that's being passed through the federal government right now, anything that NAMI National might support is also in that newsletter. So feel free to take a look at it. And if you have any questions, please reach out to me. Be more than happy to sit down and answer them. I think I'm at miscellaneous already. I didn't think this was going to be a long call because there's not a whole lot happening right now. Just that we need a budget sooner rather than later. I did get an email from National yesterday. Yesterday was Monday. Yes, yesterday was Monday. There is a NAMI Smarts facilitator training coming up on October 24th. If you are interested in that, please email me as soon as possible, so I can get your information. I can get you the application. The state of Pennsylvania has been allotted 3 seats. I do have one person on my waiting list, so I'll be reaching out to them. So 2 potential seats available, first come, first serve. So again, if you're interested in attending the NAMI Smarts Facilitator training, please send me an email and let me know so I can get you the information to apply. It is an all-day training. I will tell you that. It usually starts around 11 to accommodate for our friends on the West Coast, as to not have them out of bed at 5 in the morning participating in a training. It usually runs from 11 to 6 Eastern Time. There is a NAMI Smart session that they would like you to attend the week before the training. It's usually done twice that week previously, or the week before the training, and then they record it and make it available for you. And then in addition to those 2 requirements, the following week after the 24th, you'll have to get on a Zoom call and kind of do like a little teach back session with the NAMI national staff. It's super easy, no pressure, not very difficult at all. So, that will allow you to lead the NAMI Smarts training, deliver those trainings. I know we've talked about it several times before, but as a reminder, that's like the whole telling your story thing. There's modules on 988, on budget, medication choice, parity, all kinds of things. It's a great program. There's even modules on, connecting with your representative senators, getting ready for that meeting, effectively sharing your story, not just writing your story, but how to effectively share it. So that'll allow you to lead those trainings. Again, if you're interested, just shoot me an email. I'm going to keep the link for the legislative members for this session on the agenda, just so it's easy for you to find. If you do need access to that at a later date. For our NAMI friends on the call, every legislator is listed, and whatever NAMI is in that district is listed in the far right hand column. So, and for everybody else, it's incredibly useful. It has their contact information, what district they're from, what areas that district covers, any committee assignments, things of that nature. So letter C in miscellaneous is our advocacy capacity building sessions. I talked about those at the beginning of the call, but I wanted to let everybody know that, again, those 2 are available on the website. I have that listed last, but coming up September 23rd, we have one for financial planning for a loved one with mental illness. And then for October, we have somebody from FAN lined up to come speak to us on Medicaid and how those things are going to impact, the federal decisions are going to impact the state level. I'm personally really looking forward to that one, because I think I know a lot, and then I hear new things. So I'm always up for learning more information, especially since it's going to be such a broad impact to the individuals that we serve. So November, we're looking at reentry services. I know Christine has been speaking with someone and has someone potentially lined up. So once we land on dates for both of those, look for an email from Christine. If those are something that you are interested in participating in, and you don't already get her email blast, I know she mostly blasts to affiliate leaders. Feel free to reach out to me and I can connect you with her, so that way we can get you signed up for those webinars. And honestly, that's all I have on the agenda. But if anyone has anything else they want to talk about, anything I might have missed, like I said, I'm feverishly trying to play catch up. So I've been trying to stay on top of things, but.
Nikki, it's Bethany from Staunton Farm Foundation. I just want to let everybody know we're having our biannual Staunton Farm Rural Behavioral Health Conference September 25th at the Cranberry Marriott. If you go to stauntonfarm.org, you can register. I would throw it in the chat real quick, but I don't think I'll be as fast as Nikki logs us off. So again, Staunton Farm Foundation. You can find us on our website and you can register there. There'll be CEUs available. And Jim Sharp from RCPA is the keynote speaker, and we'll be speaking really about everything that we're discussing, well, budgetary issues and how to survive in this type of climate. And I know Monique's on the call and she will tell me if I was wrong. So thank you.
Jim is great. Thank you, Monique, for putting that. No,
Yes, thanks,
I'm
Monique.
trying to type it out, but I couldn't get there.
Nikki, a few things. I'm curious if any, so after the bill passed in early July and NAMI National sent out some stuff like, all right, what do we do now? One of the recommendations had been that not every state, but many states have like a Medicaid advisory committee at their state level. And so I was curious about that because I hadn't heard about that. And so I looked at it in PA and it looks like we have a medical assistance advisory committee. And I'm curious if anybody on this call has attended that before. It looks like a Sunshine Committee meeting, and I am attending, myself and someone else are going to be attending on behalf of Chester County.
Okay.
Like virtually. They do have an in-person at some point towards the end of the year. And I'm just curious if anybody else has ever attended, because it sounds like what National was saying, like the way that this gets implemented in each state is going to be potentially different. And so if you can get in on those advisory meetings, that's a really good, like, it's good to be there to hear what are they talking about? What decisions are they making?
Yes, I know of the MAC meeting. I personally have never attended because Lloyd attended forever and ever. I don't know if that's one of Lloyd's things that he's still doing in his flex-tirement. But he, yeah, Katie says he still attends that meeting. And he frequently sends out, I'll call them narratives, a play-by-play for everything that happens in that meeting. That's something I've been meaning to get involved in, so thank you for bringing it to my attention. Because I read that email too. One of the things I actually have on my list to talk to Chris about this Friday. So thank you. But I'll go through and see what Lloyd sent out recently regarding those meetings. And Sarah, I'd be more than happy to forward that information to you. Like I said, he regularly attends. And like I said, he usually provides a pretty comprehensive narrative, anywhere from 8 to 10 pages or longer, depending.
I've seen
But
his narratives before.
yes, yeah, usually a minimum of 8 pages for any meeting Lloyd's at. So
Another thing I'll put out there that I've been hearing in Chester County is that, so even though we know that implementation of the bill is still a bit off, we are hearing from our hospital providers that if they have folks that are coming into the emergency room with a primary behavioral health issue and need to be transferred somewhere that is inpatient and they do not have insurance, they're finding it a lot harder to place people because the facilities have concerns that they are not going to get paid. And so it's been a lot more difficult to place folks. And so I heard this in a meeting and then it came up again in another meeting, and one of the providers who actually has not been difficult to place people with, but the majority of their census tends to be folks who are using Medicaid. He said that since the beginning of this year, they're getting a lot of pushback when someone is going on, say, emergency medical assistance on getting approval for stays under emergency medical assistance. And they're receiving communication that if a person is not actively suicidal, like each day that they are there, they're not going to cover the days that they are not actively expressing suicidal thoughts and such. And so just kind of bringing that to your attention that at least in Chester County, we're finding that what I'm hearing from our medical community and also our inpatient hospital is that it's getting difficult already to place people because the providers are afraid they're not going to get paid.
Our issue with the area agencies on aging and older adults is pretty extreme when it comes to finding a placement for an older adult with serious mental illness that also needs nursing facility care. And I know this is a little unrelated to what you were sharing, but you know, there are some similarities to it. And there has been a program in Philadelphia that was built out of what they did is built out 24 beds in a nursing facility for people with serious mental illness. And a lot of folks have probably heard about it. And then they expanded it from 24 beds to 48 beds. And now they just broke ground on a new facility. But my state association, P4A, has been working with the Hospital and Health System of Pennsylvania, HAP, and the state association that represents nursing facilities. And we're working on trying to develop sort of a hub model similar to what Philadelphia has created, but have a sort of a nursing facility hub in each region of the state that could possibly take our older adults. But what you're talking about, Sarah, is a huge issue because if we don't have the funding that can go with that person, and you know, we run into huge problems. Of course, we have community health choices, but like you were mentioning, not everybody qualifies for community health choices. And when you're talking about an emergency Medicaid and how long will that be in play, I mean, those are, I just think, well, everybody, these are really rough waters, you know, that we're in right now. And it doesn't look at all like it's going to be calming down anytime soon. But thank you for bringing that up. It's really scary. And you understand how providers feel. You know, they care about the individuals in their communities, but they have to get paid. And these hospitals are really taking a hit. I mean, we have one individual we've been working with Armstrong Hospital about, and he's been in their acute psych unit. And their acute psych unit is intended to be a 3 to 4 day stay, and he's been there since January 11th, and they're not able to find a placement for him anywhere in the Commonwealth. And frankly, in these cases, like this gentleman Everett in Armstrong County, the only places, and you guys have probably heard me say this before, that we've been able to find are Ohio and New Jersey. And yeah, I mean, it's just the saddest thing. I can't even begin to tell you, which puts the older adult further away from their families, and that's not a good thing. But that's been our experience. It's a huge problem, these placements for people who are low income, whether they're Medicaid or not. Yeah, really, really good point.
Sarah, I thank you for bringing that to my attention. I took some notes on what you were saying. I'm gonna talk to Chris, and if you have a meeting scheduled anytime soon with Chris, you may want to talk to her too and see if we have a connection to the Hospital Association of Pennsylvania, and see if maybe they have a process or any kind of guidance or like insight on why that might be happening, or if there's any like kind of prevention strategies that are in place right now to kind of circumvent that. Because I know it's happening here locally, in Ohio where I live as well. I think I've mentioned to everyone before, I'm on my local mental health and recovery board, and we're a 3-county joinder. We're a rural area, and we actually have a board meeting tonight, and I'm very interested to hear what's happening here, because I know like we're already having problems now because we don't have any close by, we don't have any psych facilities at all. So anybody from the greater Wheeling, West Virginia area that needs psychiatric assistance has to go to Morgantown or Pittsburgh to UPMC. So it's been interesting, and of course, once you start crossing into state lines, medical assistance gets blurry as is. So yeah, but I'll definitely bring that to Chris's attention next time I see her, and then maybe you and I can chat about that offline, and hopefully I'll come with a solution to the broader group next meeting. Thank you both for bringing those things to my attention.
And Nikki, Jennifer Jordan at HAP is in charge of all of their behavioral health policy work, and she's fantastic. If she's my contact person, has been working with our coalition. I'll be happy to send her contact information if you want me to.
Thank you. Yes, Lynn, I would very much appreciate that. And Lynn has jogged my memory as to something I did not put on the agenda that would fall under miscellaneous. Mental Health Planning Council is having an in-person meeting for the first time since COVID, so going on 6 years now. On September 18th at Patan in Harrisburg. Mental Health Planning Council is a sunshine meeting, so we'll gather registrations from 9 to 9:30. We have Deputy Secretary Arkush from DHS coming to speak first thing in the morning. Then we'll break out into the individual committees, adult, children's, and older adult. We have some lunchtime activities planned, including speed networking. And then in the afternoon, we'll all come back together for the joint session. So I'm incredibly looking forward to it, mostly because I'm not even the co-chair of the adult committee right now, the sole chair of the adult committee right now. So hoping to elect a new co-chair during that meeting for my committee, because it's a lot to keep up with. But I'm really looking forward to that. Like I said, it's been probably close to 6 years now since we, as Planning Council, have been able to get together. And pre-COVID, this was always one of my favorite meetings to attend because it's a great networking opportunity. And now, in the day and age of Zoom, it's always good to put a real human 3D figure to the Zoom squares that we're all used to. So I'm looking forward to that as well. As there's people I've been working with on the Planning Council for years, and I've never actually met them in person. So I'm incredibly excited about that. And again, that's September 18th. It's a Thursday, and it is at Patan in Harrisburg. Registration again from 9 to 9:30. So if you're available and looking for an awesome, outstanding meeting to attend, I would highly suggest it. But however, they're still going to be hybrid. So if you're not able to make it in person, keep your eye out for the OMSAUS Blissserv, and those links should be coming out here momentarily if they haven't gone out already. Actually, I think they may have gone out already because I RSVP'd to the virtual invitations. So, yeah. I think that's all I have. Does anybody else have anything before we say goodbye? Hopefully we'll have some more answers in September. Although Katie dropped in the chat that there's not another session day scheduled till September 22nd, so we'll see.
Yeah, but they have added some in. So I just know you mentioned earlier, like, is it going to be an ad hoc? So maybe we'll have some more. It's just not official until September. So
Gotcha. Yeah, I feel like they just can kind of throw them together at willy-nilly. So glad they're still working though, because we need a budget. All right, everyone, have a great day and an even better week, and I'll see you next month.
thanks.
You're welcome. Bye.
Yeah. Thank you, Nikki.